Hello, all you beautiful people, and welcome back to another session of Do It Right with Dr. Ansu. That's me. Today, we're going to continue our interview series, and in honor of Women's History Month, I am going to have a friend of mine who is an osteopathic physician. She went to the same med school as I did, and she works as a psychiatrist. I feel, especially with the COVID pandemic and with everything that's been going on, anxiety and depression is something that we've been seeing a lot as a physician, as a family practitioner myself. And I am so excited to just talk about her perspective and her journey as an osteopathic physician and a psychiatrist. So let's get started. So, hello everybody, and welcome to another session of Do It Right with Dr. Ansu. That's me. And in our interview series, I have my dear friend Ludmilar Mesidor, Dio, and she is a psychiatrist. She is a children's and adolescent psychiatrist. She also went to the medical school that I graduated from. She was a year ahead of me, and I absolutely love their class. I think you guys had some of the classiest people who graduated from there. So just a little bit more about Dr. Mesidor. She did her residency in general psychiatry at New York Medical College, Westchester Medical Center in Valhalla, New York. She did her fellowship in children and adolescent psychiatry at Alpert School of Medicine at Brown University in Rhode Island. And currently she is doing private practice and telehealth, correct?
Yes.
Thank you so much for joining us and welcome. And it's so good to see you. So, Ludi, which we like to call her as, just to kind of, for our audience to get to know you a little bit more personally, just tell us, how you even got to where you are, what made you want to go into medicine?
So my father is actually an internist. And so I grew up with medicine in my life. So it was something I was always curious about, something that I always was attuned to. I mean, I was like in middle school and my dad was teaching me how to do blood pressure and do cardiac exams. So I was always kind of interested in it. And then in high school, I actually thought about potentially being a psychologist, actually, and getting a PhD. But then I really thought to myself, I want to kind of know the whole body. I want to know the medication aspects. I want to know the biological, physiological aspects. So at that point, I was like, you know what? I don't want to get a PhD. I really want to go to medical school. So, and potentially become a psychiatrist. And then years later, after college and everything like that, and getting into medical school, and I'm sure you'll ask more questions about that later. I went in wanting to be a psychiatrist, but then I kind of got discouraged by some people because of, there's unfortunately a stigma against mental illness. And some people are like, do you really want to do that? And, it's going to be really hard. And, people are going to, all this sorts of things. So at that point, I said to myself, okay, well, maybe I'll be a dermatologist, or maybe I'll be a pathologist or something like that. And I played with those ideas in my head, but I really didn't have a real passion for them. And then when I was in my third year of medical school, and you do your rotations, we had my rotation in psychiatry, and I absolutely fell in love. I fell in love. And the place where we rotated at, which unfortunately I can't remember it anymore, and I know that it actually closed down, which is really sad because they gave a lot of resources, but it was in Queens, and they had a children's unit. And the rotation was supposed to just be for adults. But I found myself creeping downstairs when they let us go and hanging out in the children's unit. And I actually asked them if they minded if I stay there. And I just loved being with kids. I felt so much hope in helping children because the potential is so grand, because they haven't really done most of the stuff that could potentially negatively impact their lives or careers or future. Mm-hmm. And so I just was so rewarded by the experience. And at that point, already in third year medical school, after that rotation, I decided I wanted to be a child and adolescent psychiatrist. Awesome. And then from then on, I did a lot of electives in that, and I went into psychiatry residency, knowing that that's what I wanted to ultimately do, and kind of went through all those avenues, and here I am.
So that's really cool, Lodi, because I feel like when I talk to a lot of other providers, usually that third year rotation is where they're kind of testing the waters. But for you, you kind of already knew this is what you wanted to do, right? So how was it for you going through the rest of medical school? Were you training yourself to, do psychiatry, but kind of, filling up your toolbox with other information? Or did you ever potentially think you may go into something else while you were doing rotations?
Well, like I said, I at the beginning of medical school, I had gotten discouraged by some people from going into psychiatry. So I actually, like I said, thought about doing derm. I thought about path. I thought about that. It wasn't, and psychiatry was not my first rotation. So my first rotation was actually internal medicine.
Mhm.
And let me see if I can remember so long ago. I think it was followed up by pediatrics, if I can accurately remember. But I had like 3 or 4 rotations before psychiatry,
Mhm.
and with every one of those rotations, I was like, no, 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 this isn't it, this isn't it, this isn't it. And then I went to psych, and it was just like, boom, like
This is
this is because it was the one thing that I did that I wasn't constantly watching the clock and wanting to leave. Everything else I was kind of like, okay, when is this rotation over, or when is it, what time, or we get through the patients so I can get in my car and go home. But with that rotation, like time would fly.
it.
And I was like, wow, I'm like actually enjoying this, immersed and fascinated and interested in this. So then from that moment on, there was no questioning for me. And anybody who said, oh, you sure? I was like, no, this is what I'm doing. Like,
Awesome. So, as a daughter of a physician, is there any childhood memory that stands out to you that either was like made you be like, this is what I want to do, or oh my gosh, I can never see myself doing that, or anything that stood out for you?
yes, actually, you're. So that's very, very much so. So ironically, this is very ironic, but when I went to take your daughter to work day when I was in 6th grade, I was sitting in my dad's office and taking his prescription pad and writing prescriptions to Ritalin, which I would spell wrong, by the way, because I write it phonetically. And I prescribed it to kids in my class that I thought were annoying. Um, and that's really funny because I had no idea what child and adolescent psychiatry was, had no idea what psychiatry was in 6th grade.
No, like
So
divine intervention.
yeah, so I remember when I told my father that I wanted to be a child and adolescent psychiatrist, he's like, do you remember when you were in 6th grade that you were in my office and you were using my script pad and writing prescriptions for Ritalin? Your classes. so 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 that was some foreshadowing. I definitely knew I did not want to be an internist watching my father, because I felt, by the way, I have so much respect for internists and in basically every specialty, because it's really what fits for you and what you're interested in. And no specialty is better than any other one, but everybody fits into different things. And I just saw how large the scope was for my father being an internist. The scope was so wide.
Mhm.
And I felt like the hours that he worked were so long, and it just seemed like something. And then, like, my dad's a very academic person. He actually was on the educational staff for downstate medical school too. So he would do like the rotations for interns and residents and stuff like that. So all that rounding and pontificating was just like not for me. I remember watching him do that when I used to like visit him at work, and I'm just like, I don't want to be standing around and talking for hours. So I knew that wasn't gonna be my life. So yeah, those are some of the
That's awesome.
memories of that.
And what led you to tour college, or specifically in osteopathic medical school? Was there an experience that you came across? What led you there?
So for me, I knew I wanted to be a physician, and then my primary care physician, he was a DO. And so that was my first relationship with DOs, and he was amazing. Dr. Ostrager, I still remember his name, Dr. Brett Ostrager, and he was phenomenal. And when I was in college and it was time to apply to medical schools, he was like, you should try to apply to DO school along with allopathic school, because DO schools have really, and so he's the one who first started telling me about them, about the perspective that DOs have, and about osteopathic manipulative medicine. And he, I think, was a graduate from NICOM, if I recall correctly. And so, giving his advice, I did apply to osteopathic schools as well as allopathic schools. And it was very important for me personally to be in New York because my then fiance, now husband, worked in New York, and my family is in New York, and so is his family. And I knew myself. That's one of the gifts I've been given. I knew myself very well, and I knew that I would need that support. Some people can, be on their own and just do. I knew I would need that support, so I really wanted to stay in the same state as them. And so I had gotten an email about a new medical school that was opening up because I'm in the inaugural class of Touro College of Osteopathic Medicine. And my husband, by the way, was also starting to work at Bloomberg Business Week, which was also in the city. So I said, okay, let me go see what this is about. And I got contacted by now Dr. Obed Figueroa, who's a PhD, who was doing our intake at the time. And it just seemed like it would work with my life, and it work with my family, that it would fit in with everything that I was doing at the time to go there. And I really liked the idea in osteopathic medicine of really doing holistic care. Like, even in my practice till this day, and this is one of the things that I think is really a strong point for DOs in osteopathic medicine, is I really look at my patient in totality at all times. And I'm always looking to see like what kind of environments they live in, what their mother's like, what their father's like, what their relationships are like, their economic situations, whether their back hurts. I mean, even though I'm a psychiatrist, whether their back hurts or whether their leg hurts, I really look at the whole person. And, one of the things in the telehealth company that I work for is I get really good ratings. I usually get 5 stars, like 90 something % of my patients give me those ratings. And one of the reasons I think, and one of the reasons they say usually when their comments, is that I've really treated them like a whole person. And I was very attentive to them. And, for example, I had a patient last week who has been telling me they have really bad chest pain, and they went to the ER, and they said, okay, well, you have an inflammation, in your rib cage or something. And now they put her on steroids. And I'm like, wait a minute. I'm like, did you? And she's seeing a internist, and I'm not pretending I am an internist. I'm a psychiatrist. But she was saying how it hurt so bad. And I said, well, did you injure yourself? Because she's relatively young. She's in her 40s. And she said, no, I didn't injure myself. Anything like that. I'm like, that's very odd. Like, why would you listen and get such strong pains? And then I made a comment to her. This woman has very large breasts, like almost like a very almost like an HJ size. And I said to her, have you ever talked to anybody about, your back, and like, are you somebody whose back hurts? And so we got into this conversation. I said, you might be having this severe pain due to the size of your breasts, and whether or not your posture is accurate, whether or not you have a fitted bra, these are things. And she's like, oh my goodness, I never thought about that, because they already had done echoes and everything on her, and they couldn't figure that out. So, that's just the way I think about people. I don't know if every psychiatrist would have went into that with their patient, but that's kind of how I practice medicine. And I do give some credit to that, to being a DO, because I kind of just look at people in totality, and not just, okay, she's here for depression, and that's all we're going to talk about.
And I really appreciate that you said that, because I don't want people to think that DOs need to be doing OMM. I feel like there is something to the way we do see patients, and I think you just presented that beautifully. It's more than just that specialty. It's more than just the issue that they're coming in with. It's the whole package that we look at. So thank you for that. So as a psychiatrist, I can imagine, that whole physical touch aspect may not be as much there, just because you're dealing with mental health. But it was interesting that you said, there was that stigma that you had to deal with going through rotations. As a family practitioner who probably sees a fraction of how much mental health you see, it's hard for me to imagine that, right? Because there's just so much mental health issues out there, and yet that stigma still exists. So how do you come across that? What how do you address that? How do you make your patients move past that stigma they probably experiencing also?
Yeah, I mean, we're all living in it.
Mhm.
And, I'm a huge advocate, but even I am like subject to it as well.
Mhm.
And I always tell my patients to normalize it that, just because you have a mental illness, it's just like any other illness. And I think that's the biggest thing that people don't realize. Like,
Mhm.
it's just like if you had diabetes and you needed insulin,
Mhm.
or you had high blood pressure and you needed medication. It's the same thing with anxiety and depression. We need to treat it.
Mhm.
And one of the things I often say and try to tell people is that mental health is not static,
Mhm.
right? It's just like if you exercise and eat right, and then you decide to stop eating right or stop exercising or you get injured, let's just say, and you stop doing that and you gain a whole bunch of weight. Weight is not static. Weight and fitness has to be tended to on a daily basis,
Mhm.
right? And same thing happens with mental health. Like your mental health is not static. Just because you're quote unquote normal, and normal is a very relative term, right? Doesn't mean you're always going to stay that way. There's going to be traumas that happen in your life. There's going to be more difficult periods that happen in your life. And because of those different changes and variations, you may be fine one moment and 2 or 3 weeks later you have an anxiety disorder.
Mhm.
So I always tell people that, it's something that we all have to watch out for, that we all have to monitor, looking at our sleeping patterns, our eating patterns, our irritability, how our relationships are going with people in general. So it's something that's going on always, and it's just like any other health issue that
Mhm.
you may have, that you need to go see somebody and get medicated for.
Mhm.
And I try to let them know that they're not alone and that many, many Americans struggle. Not for nothing. And I don't know if this is accurate as of 2021, because it was a while ago I read this article, but antidepressant medication is like one of the most prescribed medications in the United States of America. And I don't think people realize how pervasive anxiety and depression are in our society for a
Right.
multitude of speculative reasons. But it's pretty common. And so I try to really try to normalize it and just basically let them know this is a pervasive thing that many people will deal with at least once in their lives, if not multiple times in their lives, to try to get them to not be fearful of getting treatment or be fearful of discussing it with others.
And it's interesting because people forget that the mental health aspect affects the rest of their physical health, right? The amount of times I have patients who are coming in for like completely unrelated issue, and as we're talking, the next thing you know, they just start pouring out that anxiety, depression component. It becomes a whole different type of visit. Tell me about the children's adolescent psychiatry component. Like, I can't imagine that being easy. So, how do you go about that?
So it definitely is not. So a fun fact for the viewers out there, child and adolescent psychiatry is actually the most underserved specialty in all of medicine. And there's multitudes of reasons for that, but one of them is it's particularly difficult specialty to manage in terms of dealing with children with mental health issues and their families and schools and systems.
Mm-hmm.
And one of the things that drew me to that, and I've written this in essays when I applied to fellowship, was that, not that adults can't change and get better. I mean, I still treat adults in my telehealth work. My private practice, I treat children. But so adults can change, adults can get better, adults can do really well. But children specifically was something I really enjoyed because like they haven't gotten anywhere yet where things that they have done are going to make an impact, meaning like they haven't, dropped out of school, or they haven't, got in trouble with the law, or sometimes they have, but it's not, juvenile stuff doesn't stay on their record past 18. So like there's no huge life altering decisions most children have made, most children in general, by that point, even in child and adolescent psych, that are necessarily going to have massive repercussions going forward. And so I feel like when you can capture somebody that early on and kind of change course for them and their family, the potential impact in terms of what they're going to end up growing to be and being able to function as adults is huge. Mm-hmm. And there are many studies too, and I don't have the exact percentage in my head, that show that most people or most adults with mental illness have had it since they're children. Mm-hmm. It's just not diagnosed, not properly tended to, and not recognized and acknowledged. Part of the problem is that a lot of mental illness in children appears in ways that, especially if people aren't aware or are old school, think, oh, this kid's just bratty, mm-hmm. or this kid just doesn't listen. In reality, the number one way that depression presents itself in children is actually irritability. So people think that their kids are just being cranky, which their kids could be cranky. Everybody has bad days, but if you notice your kid's constantly cranky and they're sleeping well, relatively, and they're eating well relatively, but they're constantly cranky, something else might be going on there. And it's not just them being a brat or, those kinds of labels. So the challenge with children is that they are part of an ecosystem, right? So whereas an adult, most of the time, not all of the time, is living independently, can make their own choices. For the most part, a child cannot. They're part of a system, right? So they're only being given food that either their parents or their school or caregivers are getting them. So they don't have all the choices in food. They don't have all the choices in activities. They don't have all the choices in where they go to school or all these kinds of things. And so kids have a lot of the things affecting them are out of their control. Right. And so in order to help a child, you can't just treat the child, you have to treat the environment. So you have to work a lot with parents, foster cares, group homes. You have to work with schools, talking to their teachers, to their principals, mm-hmm. Because all these environments and the different situations that arise in it affect the child as well. So that's what particularly makes child and adolescent psychiatry more challenging than just general psychiatry.
As someone who deals with, so much mental health, especially when it comes to children, I mean, I don't know about you, but whenever I have kids who come in and there's concerns of depression, anxiety, identity issues, so many different topics, part of me, I come home with a heavy heart, because there's this child who I came across who is just struggling, and and the support they may need, they may not necessarily have. How do you deal with that? Because you're married, you've got 2 little boys, so you've got this life you're coming home to. How do you deal with that? How do you go every day with a happy heart, knowing that there's so much pain there?
So one thing that I think is actually kind of sad, and I think should be in all residencies, regardless of what you are practicing, is supervision. We do it heavily in psychiatry, but it's not done in other specialties, which I think is interesting because all physicians encounter trauma. Mm-hmm. So it'd be interesting to see for people who are like really into medical education in the future, whether or not that should be something that everybody has available to them. And so what is supervision? Supervision is you have either an attending physician or who's senior to you. So that basically means, for those of you who are not in the medical field, like a senior physician who's like finished all their training, or you have like a psychologist who's also monitoring you as well. And basically what happens is when you're seeing patients working in the hospital or whatever, you meet with this person about once a week throughout your training, and it can switch every year. Like they used to switch my supervisors every year just so you get different flavors and different things. And you meet with them and you discuss the cases that you've seen, questions that you've had, things that you've struggled with, and you can work a lot with them in terms of figuring out how to manage these types of emotions and ways to work in this. I remember when I was doing consult liaison at Brown at one point, I had a particular psych consult that really affected me, because then it went into a question of child abuse. Mm. And then we had to get, and Brown fortunately is very well staffed and the resources are unbelievable. So they have a whole child abuse team that just focuses on child abuse. So psych doesn't really get involved in that. So we had to, once I discovered that there was some child abuse concerns, Then we got the child abuse team involved, but it was very disturbing what came from that. And I remember going home and feeling very heavy-hearted. I think I might even had a nightmare. And but I was able to discuss that in supervision, and it helped a lot. And I've developed every psychiatrist or even physician, like I said, because we all deal with trauma. ER doctors deal with trauma. You're dealing with trauma because people come to you when they're in distress and pain. And every doctor comes up with ways in which to cope with those things. Hopefully they're healthy ways and not unhealthy ways. For me personally, I don't watch traumatic things. So like a lot of people will tell me, oh, like, have you seen such and such movie? And I'm like, nope.
You sound
They're
just
like, yeah, they're like, oh, it's so good. And I'm like, no, because I have to balance the amount of trauma that I experience. So if I'm going to be hearing, people tell me about assault or, different horrible situations that have occurred to them, then the last thing I want to do in my free time is watch a movie that involves significant trauma. That, for me personally, I know like I said, every doctor and psychiatrist deals with this differently. That helps me a lot, like compartmentalize things and not get consumed by the trauma. I also, you have to also set boundaries for yourself in terms of, most of us, at least for me, go into this wanting to help people, right? Because if we wanted to be rich, this is not the way to do it. It's not the easiest way to make money. So, sometimes we tend to do too much to a point of overextending ourselves that can cause us harm. And learning where to put like limits on how we interact with our patients and how much we allow their pain to be our pain is like very important. So those are the kinds of things that I do to do that. And of course you have to take vacation every once in a while just to like, unwind, unload, and kind of give yourself a break from all of that.
So let's talk about that. How is work-life balance for you?
Ooh, that's been that's been a constant battle as a mother and a physician, and my husband works as well. It's been a challenge. Everybody has to know their limits of what they can do and can't do, and also obviously finances play a role in that. Like not everybody has the luxury to work more or less depending on their financial situation. But for me, I've figured out 2 part-time jobs that I juggle and that allow me to be able to be very involved in my children's life while still being a physician and seeing patients, and then possibly exploring other ventures in the future with, I've been thinking about doing some health and wellness coaching and that kind of stuff. So I think I found a really good balance pre-pandemic anyway. Pandemic has
COVID-19 came and changed everything.
Yeah, when pandemic came, everything got really thrown for a loop. So my balance has been very off during this pandemic. But prior to this pandemic, when we could go outside and do things and kids can go to grandma and grandpa's and do stuff like that, it was, I think for me, a good balance. And that's going to constantly evolve too, right? So as my kids get older, I plan to get involved in things that I am not doing now, because having very young children makes it difficult to manage those types of things.
Yeah. So going back to the medical school years, do you feel like you were well prepared to go into residency? Especially, I'm hoping some of the people who are listening to this are future medical students who are probably deciding, do they want to go allopathic route, osteopathic route? Will they be prepared if they go to an osteopathic school? So do you feel like you were prepared for residency? If you had to do it all over again, would you change anything?
I do feel that I was well prepared for residency, as well prepared as you can be. So, a common misconception is a lot of med students get to like 4th year and they're just like, oh, well, what do I need to study to be an intern? It's like nothing, because it's one of those experiences that you really can't prepare for.
Mm-hmm.
It's kind of like being a parent for those who are listening that may be parents. It's just like, you can read about it, you can like look at it all you want, but until you're in that room with those patients doing charts and doing things and dealing with emergencies, you just are not going to be able to learn that. So regardless of being osteopathic or allopathic, that's going to hit you. It's universal, and you know that it's universal because I went to an allopathic residency and we all had the same experience,
Mm-hmm.
whether we went to DO school or allopathic school.
Right.
So that being said, though, I felt like I was well prepared. I actually would not change anything, and I can honestly, enthusiastically say that.
Mm-hmm.
Being in the inaugural class of Toro was, as you know, was a very wild ride for us. A lot of ups and downs, a lot of things, because the school really wasn't prepared. And right now they run like a well-oiled machine. Whenever I hear all the stuff they're doing, I can't even believe,
Absolutely.
Yeah, I mean, they're like a phenomenal institution. But when we first came there, it was rough. However, I actually don't regret it for anything, because friendships that I had made and the connections that I had made were so deep and profound. Like, even you just reaching out to me to do this interview, I don't talk to people for weeks and months just because of life, and we will reconnect and start talking again as if it was yesterday, because we have such a bond, having gone through that experience, and we understand each other in ways that other people might not, in terms of different things. So due to that, I would never give that up, because that was a really wild but really beautiful experience that I've come out with. Like, I've talked to many of my fellow classmates recently who are at their private practices or running businesses and directors of things, and we chat and catch up and send each other baby pictures. And so I actually would not have changed any of that. And we were also a very tight-knit group. A lot of med schools, and I don't know what the culture is there now, are very cutthroat in terms of people not helping each other, people not sharing with one another. And we had an environment where people helped each other by giving them their notes from class and studying with one another and really trying to help all of us. We helped each other succeed. And so I wouldn't change.
There's something about going through struggles together, right?
No, there really is. I mean, we still laugh. I mean, sometimes, like, even if you look at our Facebook chats, like, sometimes they'll come out, somebody will say something about med school, we'll all just like chime in, and we haven't talked to each other, some of us, just because of life, and we're in different states and married and have kids, but we'll be like, oh yeah, remember that and everything, and how about your kid? And like, we'll all be like cracking jokes, and there's just something about that experience that we had that really bonded us, I feel like, for ever, because I think we're hitting 10 years now.
Yes.
So no, I don't regret anything. I felt I was very well prepared, and like I said, I felt like it gave me a interesting perspective. And then not only that, there is something to training in situations where there's not a lot of resources. So not many people see this as a strength. But, when our school first opened, we didn't have the access to like the best or most resourceful hospitals in terms of having resources and having anything. So we learned how to do things with little resources. And that's actually been a strength for me throughout my training. I remember when I got to Brown at the end of my medical training, and, if we were missing this or that, some of the other fellows would be like, oh my gosh, we don't have this or we don't have that. And I'd be like, okay.
You'll survive.
Yeah, like I would get annoyed by things too, but there was just some things I was just like, okay, because I knew and I'd seen and I had experienced how to do without those things that everybody expects. And I also, there's something to, when you work in those types of environments, you're usually dealing with very disadvantaged people who don't get good access to medical care. So you end up seeing some of the worst cases. I'll never forget, I think I was rotating in Bronx, Lebanon for internal medicine. And I remember they used to have endocrinology rounds, weekly meetings. And the sugars that people used to come in with, like, I remember my jaw dropping, because in medical school, when they had taught us earlier before our rotation, about blood glucose, I didn't think people could be alive with glucose that high.
Right.
Now people showing up with like 700 glucose still talking to you. It's like, is this a lab error? How are you still alive? Like, how is this? And that's also been an interesting experience to see, because when you train seeing like some of the more extreme cases, it kind of gives you a more of a toughness and flexibility and readiness to be able to do things too. So that I think gave me more grit going forward.
Awesome. So as a telehealth psychiatrist, how does that work? Because I'm sure, especially right now with COVID and people not really being able to see each other in person, it can benefit from a telehealth talk. So how does that work?
So one of the things that's awesome is that telehealth in most states, not every state, unfortunately, but most states is legal. Mm-hmm. And I think it's wonderful that it's growing. It's growing so rapidly now for psychiatry specifically, because like I said, especially for children, it's the most underserved specialty. Although I don't see children in my telehealth for my own personal reasons. But even adult psychiatry is very, very scarce. Mm-hmm. And so what it does is allows a doctor to be licensed in multiple states, so that people who are in areas where there's no psychiatrist for miles, or they can't afford an out-of-pocket psychiatrist, if many psychiatrists are cash only, they can have access to a psychiatrist. And it's very accessible, and they can see them in their own home. Or some telehealth is set up where you go to like a clinic and then they have like the cameras on, but it allows people to have greater access that they wouldn't have. There's places in states and counties where there's no psychiatrist, so there's one for a whole county. Mm-hmm. So I think it's a wonderful thing for people to do. Most people have mild to moderate psychiatric symptoms. Mm-hmm. It's completely appropriate to use telehealth.
That's awesome.
It's completely appropriate. Only if you're really severe. So like, obviously, if you're like suicidal, or you have a very severe personality disorder, telehealth, or you have psychotic symptoms that have not responded to multiple different types of medications. Those types of people, telehealth is not appropriate for, and I end up referring them out. Mm-hmm. To a local place, because they really need to be seen locally within their state. Mm-hmm. And their location. But if you're somebody suffering from anxiety, depression, bipolar disorder, and you're having like moderate symptoms or just need maintenance, or it's new onset and you need some treatment, like as long as it doesn't get too severe, telehealth is a great avenue to take. And basically what happens is a screen pops up, like, you're FaceTiming or Zooming somebody. Mm-hmm. And, the doctor, talks to you, asks you how you're doing, does a full mental health exam, because they can see you in your body. It's pretty cool. And they can prescribe to you too. We have, we're licensed in all those states, so we can use a portal. The only thing it's not good for is if you need a controlled substance. Mm-hmm. So if you're in a state where, and when I mean state, I don't mean like location-wide, I mean like place in your life where you're like on benzodiazepines, which are like Ativan and Klonopin, or you're using stimulants for ADHD or something like that. Mm-hmm. There is a legal law, federal law, which is temporarily suspended because of COVID. Mm-hmm. However, I'm sure they're going to turn it back, where it's actually federally illegal to prescribe people controlled substances via telehealth. Okay. So, some of my patients that I see, they'll have their local primary care doctor, if they're already on Adderall or something, continue to prescribe that while I manage all the other psychiatric stuff. Okay. And they share my notes and things like that. So we'll do that. But you wouldn't be able to get it from your telehealth physician.
And this is covered with mostly all insurances?
Mostly, yeah. Most telehealth companies, they are on board with like Aetna and Medicare and Medicaid. And some telehealth companies are actually contracting with companies. Okay. Meaning like, so all the workers who, I'm just making this up, work at Staples would have the ability to work with a particular telehealth company if they wanted to for mental health services. Okay. So some of them are partnering up too, because they know this is a good way for their employees to get access to care that they
Mm-hmm.
otherwise wouldn't get. So some of them are also just partnering up with these companies so that their employees can get the care that they need.
And they do regular follow-ups with you guys.
Yes, I see them as many times as I need to. I'll see them monthly. I'll tell them, if you want, you can make a sooner appointment.
Mm-hmm.
So it's regular follow-ups, evaluation, the whole shebang. It's just controlled substances, and obviously, like I said, if things get too severe, it's not an appropriate setting to be seen. But otherwise, you would see me or any other psychiatrist on the same interval that you would see an outpatient psychiatrist.
That's awesome. I'm sure a lot of people will benefit knowing that. So my final question is, so for any students who are watching this, potentially wanting to become a doctor, what would you have wanted to hear as a student that you didn't know at that time that you would like to share? Like any pearls of wisdom?
Okay, so one of them is that everybody feels like to be a doctor, you have to be a genius. And yes, you definitely have to be smart. Most of us have average to above average IQs. However, to be honest, to be able to become a physician, you actually have to have a lot of grit and a lot of social emotional support and a lot of resiliency more than anything.
Mm-hmm.
Because even the smartest kids with the highest IQs and the best scores don't finish medical school. And the reason for that is that becoming a physician is very, very hard emotionally and psychologically in terms of all the tests that you have to take and all the different hours that you carry. And, that's a time of your life where most people, if you go straight through anyway from college, it's a time of the life where most people like partying and hanging out and just hanging with their friends. And you're kind of sacrificing most of your early years.
Mm-hmm.
And because of that, there's a lot of mental and emotional weight that's put on you.
Mm-hmm.
And so I think it's so important that people know, yes, you have to be smart and, know your stuff, but to actually succeed and be able to succeed in medicine, you really need to focus on your emotional and mental health and support more than anything, because that's really what's going to carry you through.
Mm-hmm.
That's what's going to carry you through when you do bad on your anatomy exam. That's what's going to carry you through if you, unfortunately, as some of my colleagues have done, failed a step.
Mm-hmm.
And, it feels like the end of the world.
Mm-hmm.
That's what you have to do to get through attendings that aren't necessarily the nicest, maybe pimping you out and asking you questions in front of everybody and you being embarrassed.
Mm-hmm.
So that's something that I often tell. Like, my husband has cousins who are in medical school, and I remember when he first got accepted, I sat down with him and I said, listen, I'm always going to call you and ask you how you're doing, and I'm not going to ask you how you're doing grade wise. That's not what I'm going to be focusing on. I'm going to ask how you're doing psychologically, emotionally.
Mm-hmm.
It's something that we very much neglect, and that's one of the reasons why physicians have the highest suicide rate, and it keeps
Mm-hmm.
climbing, and it's a crisis right now. So that's what I would want to have been told.
Mm-hmm. Yeah, it's funny because my mom always says that, you keep saying that life is going to get easier. When is that going to happen? I'm like, nope, it's not going to happen. It's only getting tougher and tougher.
No, it's true, and it's very, when I think of, I remember being in med school and comparing myself to kids who were, and I say kids because we're all adults, but I felt like a kid. I remember comparing myself to other people who had higher scores than me or whatever, and being like, oh, I'm not as smart as them. And it's very sad to say, but some of those people who were smarter than me and had higher scores didn't make it.
Mm-hmm.
And a lot of that didn't have to do with their intelligence, obviously. It had to do with their social, emotional health
Mm-hmm.
and resiliency. And I think that's something that's not really truly emphasized
Mm-hmm.
a lot, and it really needs to be. So to me, that's something that I would really want to tell somebody who's trying to do this.
And this is coming from a psychiatrist, so it's very important, right?
Yeah.
Thank you so much, Ludi. I feel like you were awesome. You had so many great things to share. And thank you for taking your time from your family and your kids. I really, really do appreciate it. And I'm pretty sure it's going to be very valuable for some future psychiatrist, medical student watching this. So thank you so much.
No problem.
It's great.
Thank you for asking me.
Of course. Thank you.
All right, have a good night.
Bye.